Good morning, students. Today I will be presenting a topic known as the antiarrhythmic drugs. I am Shipra Banerjee, Associate Professor of Department of Pharmaceutical Technology, Brainware University, discussing this topic. So we should know what is arrhythmia. Arrhythmia is the problem occurred in the heart when there is problem in the systole and diastole of the heart. When the heart cannot properly function and cannot create the impulse generation, that problem is known as the arrhythmia, and that problem can be cured by the antiarrhythmic drugs. So what are the drugs are used? Quinidine sulfate, procainamide hydrochloride, diisopramide phosphate, phenytoin phosphate, phenytoin sodium, lidocaine hydrochloride, tocainide hydrochloride, mexilitol hydrochloride, loracainide hydrochloride, amiodarone, sotalol. These are the drugs. So, upon completion of the drugs, you will be able to understand the pharmacological activity and the adverse effect and therapeutic effect and the chemical synthesis of the drug. So, antiarrhythmic drug agents corrects the arrhythmia of the drug where the problems are. Cardiac arrhythmia are frequent problems in clinical practice occurring in up to 25% of patients treated with digitalis and 50% of the anesthetized patient and over 8% of the patients with acute myocardial infarction. So if the patient is treated with digitalis, there may be problem of arrhythmia, and some of the anesthetized patients are also going for the anti-arrhythmic problem, and 8% with acute myocardial infarction. So there are many factors which can precipitate or exacerbate the arrhythmia like ischemia, hypoxia, acidosis, alkalosis, electrolyte abnormalities, excessive catecholamine exposure, autoimmune influences, drug toxicity, overstretching of cardiac fibers, and the presence of any diseased tissue. So they can precipitate or make the condition worsen. So all the arrhythmia results from the following, like disturbance in the impulse formation, disturbance in the impulse contraction, and both. These are the problem occurring in the heart. So the different type of cardiac arrhythmia are extrasystole, paroxysmal supraventricular tachycardia, atrial flutter. This is a problem you have studied in the pharmacology. So this is the another classification: atrial fibrillation, ventricular tachycardia, Toracetus depointus. So some of the drugs are there that we have seen the PQRST interval, which is the graphical representation of the cardiac impulse generation. So this drug prolong the QT interval have potent to precipitate toracid depoints like antiarrhythmic drugs, quinidine, procainamide, antimalarials, antibacterials, antihistamines. So these are the drugs we can procaine, which can prolong the QT intervals of the PQRST curve. Ventricular fibrillation, atrioventricular block. So these are the different rhythmic problem. So atrial flutter, you can see the heart is rhythmic in a very bad way. Atrial fibrillation, these are the problem, and ventricular tachycardia also. So classification of the drugs are going class 1, class 2, class 3, class 4. So class 1 drugs have primary action on sodium and potassium across the cell membrane. Class 2, these have primary action to suppress adrenergically mediated ecotopic activity. Class 3, these are the drugs that prolong the repolarization. Action potential is widened and effective refractory period is increased. Thus primary action is to inhibit calcium to mediated currents. Now classification: class 1, class 2, class 3, class 4. So class 1 is membrane stabilizing agents. So they are classified in three category A, B, C, which can moderately decrease the DVDT of the zero phase, little decrease in the DVDT in the zero phase, and marked decrease in the DVDT of zero phase. So A category quinidine, procainamide, diisopramide. B category lidocaine and mexilitol, and C category propafenone and flecabanide. Class 2 antiadrenergic drugs, propranolol, esmolol, that is also used for the antihypertension also. Class 3, that is agents widening the action potential, amiodarone, sotalol, these are the drugs. Class 4, there is a calcium channel blockers, that is the verapamil, deltiazem, these are the drugs. Now drug for PCVT, that is the adenosine and digitoxin. Now class 1 that blockade the fast sodium ion channel by depressing the phase of action potential. They are moderate to marked sodium channel blockade agents like quinidine and procainamide. So if these drugs are blocking the sodium channel, as a result the impulse generation will be good. Another drug, diisopramide, morphine, tricazine. So mild to moderate sodium channel blocking agents are like this: lidocaine, mexiletine, tocainide, phenytoin. So there are marked sodium channel blockade agents like fecainide, encainide, lodecanate, propafenone. Now some of the beta adrenergic drugs are there: acebutolol, esmolol, sotalol, where hydroxy group is present. That's why OL is attached. You can see for all the cases here: acebutolol, esmolol, and sotalolol, propanolol, timolol, pindolol. Now class 3 depolarizing prolongators are there, which can prolongate the depolarization. That is the amiodarone, britaline tosylate, acecanide. Now some of the calcium channel blockers, it is verapamil and diltiazem, that is also discussed in the anti-anginal drugs as well as antihypertensive drugs also. So mechanism of action of the antiarrhythmic drugs, that is the MOA. So antiarrhythmic drug class 1A, 1B, 1C. So the primary mechanism is like for the drug quinidine, procainamide, sodium channel blocker, prolong the action potential duration, and lidocaine, that is the calcium sodium channel blocker, rapid dissociation occurs, sodium channel blocker, slow dissociation occurs for the class 1C. These are the another mechanism. So drugs affecting the cardiac action potential, you see the graph here, PQRST graph, PQRST movement. So class 1, class 2, class 3, class 4 drugs are working here. So the graph you can see that is been prolonged. So these are the different another category drugs. So now we are going to the main drug, that is a medicinal chemistry, quinidine sulfate. This drug is known as the 6-methoxyquinoline 4-il 5-vinyl quinidicin 2-il methanol. So this is an alkaloid isolated from the cinchona drug. It is a dextrorotatory diastereomer of quinine. Quinine is very useful for the long term of treatment of ventricular premature depolarization or to prevent recurrences of ventricular tachycardia. It can cause synchronism, characterized by hearing loss, vomiting, and diarrhea. These are the adverse effects, but it is a very good drug. Now coming to the mechanism, quinidine blocks a myocardial sodium channel in the open state and reduces atomicity and maximal rate of zero-phase depolarization in a frequency-dependent manner. The other action of quinidinol, that is a fall in BP due to weak alpha-adrenergic blockade and direct cardiac depression, decreased skeletal muscle contractility, vomiting, diarrhea, neurological effects like ringing in ears, vertigo, deafness, visual disturbance may be there, mental changes also occurs. So quinidine sulfate is used for the Trossard's D point sudden cardiac arrest or ventricular failure, idiosyncratic angioedema, vascular collapse, thrombocytopenia. Procainamide hydrochloride is another drug. It is developed in the course of research of compounds structurally similar to procaine. It is also more stable in water than procaine. It is useful in suppressing arrhythmia of ventricular origin. It is also used in the treatment of arrhythmias in alcohol withdrawal. Gastrointestinal, that is adverse effects are nausea, vomiting to occur, weakness, mental confusion, hallucination are noted at higher doses. Flashing and hypotension are seen in rapid IV injection. Cardiac toxicity, ability to cause thoracic depoint is similar to quinidine. The hypersensitive reactions are rashes, fever, angioedema, agranulocytosis, and aplastic anemia is rare. A long-term high-dose procainamide therapy can cause systemic lungs edematous, especially in the slow acetylators. Procainamide hydrochloride are used in different cases of procainamide occasionally used to terminate monomorphic VT, ventricular treatment, and supraventricular antiarrhythmias. These are the problem we are using. Now diisopramide phosphate, another drug. Now synthesis of diisopramide phosphate you can see here. You have to practice in your own. Some adverse effects are there and cause legs problem, GI effects problem, dry mouth, constipation, urinary retention problem are there. So contraindication, this drug cannot be used for the skin, sinuses and cardiac failure and prostate hypertrophy. The primary indication of disopioid is an second drug for the prevention of recurrence of the ventricular arrhythmia. It may also be used for the maintenance therapy after cardiovascular AFib. Yeah. Lidocaine hydrochloride is a potent local anesthetic. It is reported to be twice as active as cocaine hydrochloride in the same concentration. It is also used as class 1 antiarrhythmic agents. The most prominent cardiac action of lidocaine is suppression of automatically ectopic fuel. Enhanced phase 4 depolarization is partially repolarized. The main toxicities to also dose-related neurological effects are there. Now there is another that tocainate hydrochloride, not so important, vexillity. Lidocaine, one of the drug, amiodarone. You should study in your own in a very good way. Sotalolol, some of the important drug. So thank you everyone. Just go for the slides for your brief discussion and follow the books for your detailed discussion. Thank you.